Hey, Christy.
Hi, Dr. Hurst. How are you today?
I'm good. How are you? I gotta get better light. Let's see. It's gonna rain outside, so my lighting is not so great today. Let's see here.
Yeah, it's kind of a dreary day today.
Yeah, there. Is that a little better?
Yep, I see you well.
All right. So do you want me to just start off with general overview, or do you want people just to ask questions the whole time? What are your thoughts? Because usually questions open up to a lot of discussion. So
I think maybe just start off with the like a brief overview of why you recommend the vaccine and what your experience has been with it. Okay. And then, but I'm also happy to answer your questions. So, and then in case people are feeling quiet today, I have a list of questions too that I thought would be helpful. So I've got things if people are being shy that we can talk about. So, but if you want to start with why you feel like it's a good move and, what your experience has been sort of as an introduction, that would be great.
Sure.
Okay. And I am recording it, so I'll send out the recording afterwards so that people who can't stop working to get on, or if someone's working nights tonight, that I can send it out and they can view it. And then we're doing a little contest. So if people view it, then they get entered for a prize.
Awesome. Well, cool. Yeah.
So we shall see. Oh my goodness, yes, she did have a hard good for you. That'll be fun. Come on in. I think Sarah's gonna come in too.
Yeah, so like we're on the way home yesterday, and like if I go up to Riley's or if we're
Shoot, how do I tap and put it back over there? Do you know how I send the attachment? Get it to come back? It's on here.
Like send it to yourself.
Yeah, that's what you do.
You should be able to forward it if you, what is it, right click?
There you go. All right, here's Dr. Hurst.
Hello, Miss Ginger.
Hi, Dr. Hurst.
How are you today?
Good. I have Amber here with me, Amber Hammer, one of the nurses.
Great. Hi, Amber.
And Amber hasn't been vaccinated yet, so she's thinking about it. So this would be good for her.
Oh, awesome.
Yep.
Well, I'm hoping to just answer any questions people have on that, so, or anything about COVID.
Yes.
Morning, it's Jennifer. Good afternoon, I guess. Whatever
I
time
know,
of day it
right?
is.
I was about ready to say good morning too.
You're able to keep going, right?
Hmm?
I'm not messing you up, did it?
Oh, no, it did. It did. It booted me out.
Okay, go ahead. You can go. You can go now. Do you need me to sign back in? Okay. You're almost done with it. You won't plan it. Okay, keep going.
How do I do that? It's in the classroom.
Oh.
Okay, Connie, Jeff.
I'm vaccinated.
Oh, okay.
Jumped on board for a shot.
Hey, Christy.
Does this make you do it twice too?
Can you hear me, Mark?
I have to know.
Yeah, your sharing of your screen, it's so weird, but the message that says Christy is sharing her screen is right over the controls that I need to move, oh, there we go. Okay, thank you.
Yep.
All right, Primo, thank you. I got the whole, so
Oh,
we're gonna mute now, though.
and let's just give it one more minute, Dr. Hurst, just for people who might be new to
Yep.
Zoom and logging in, okay?
Absolutely.
All right, Dr. Hurst, I think we're good. We'll go ahead and get started. And I'm going to turn it over to Dr. Hurst. First of all, I want to thank her very much for making herself available to us today. This is going to be recorded so that anybody who wasn't able to attend in real lifetime is able to view it later on. So Dr. Hurst will start with an overview, but then there will be the opportunity to ask individual questions when she is finished with her introduction. So I will turn it over to you.
Okay, thanks, Christy. So I already see and know most of the people that I'm seeing names of and faces in the room, but I'm Emily Hurst. I am the medical director for Canterbury-on-the-Lake, and gosh, I've been a part of the community for going on quite a few years now. So I think 15 plus years. So this is near and dear to my heart, and protecting and working with the family members and patients in Canterbury has been a real challenge in this last 18 months really now, dealing with COVID. So I thank you guys all for taking the time to join today. My goal is just to be open and as honest as I can be on any questions people have. I know that not everybody has the opportunity to ask questions about COVID and their fears and vaccination and all of that. To give you a little more background about why I know much about COVID, I am in several roles. One, I'm an intensivist, so I still work at the bedside through this whole entire pandemic, and have presented to the state of Michigan on the significant distress and issues that it caused our patients and our providers through the COVID-19 pandemic. And then I'm on the Michigan Department of Health and Human Services, who have been the leaders for rolling out the vaccination efforts through this process, and making sure we had communication to staff. So in addition to being your medical director, I also have some additional background knowledge and connections that I've had throughout this. And I'd just like to first acknowledge, I know that COVID has been such an overwhelming stressor to everybody in their lives during this last pandemic, and all of you guys as healthcare providers or linked to our community in any way, shape, or form, even if you're not a direct healthcare provider, this has been quite a year of challenges, and will still be providing challenges for us for a little while. So I just give my gratitude and my love that you guys have all survived this and done a lot to make this happen for not only all of the residents who live in this community, but just each other and surviving it, and the fears that people have had to protect their families. So I know it's a big deal. If you have questions at any point in time, you can either, I don't know if you want to put it in the chat or ask Christy. I'm sure she can help me catch if there's questions I'm missing. If you put your hand up or just come off mute, I'm happy to take them at any time. In a general overview of COVID, we're going into the 18th month of really the struggles that we've had from COVID. Michigan specifically has had 3 waves of infection waves through really high mortality rates. Our first one was in April and March of 2020. Then we had another one in November of 2020, and we actually just came off our 3rd. And unfortunately, the state of Michigan is still the highest in all of the 50 states for COVID infections and deaths. And I don't know how that is with all of the efforts that have been put in place in this state, but for whatever reason, we are still having a large number of cases and death. However, it is getting markedly better with vaccinations, and vaccinations are the only method we have to really present a fighting chance against what COVID-19 and the pandemic has brought to our entire world, not just Michigan and not just the United States. Vaccination allows us to get immunity. Immunity doesn't mean that you don't get COVID-19. It just means that if you get it, your ability to transmit is significantly reduced, and your risk of dying from the disease. And to be clear on that front too, when it started, the persons that were in their 80s were really the ones we were worried about that had the highest risk of mortality. Then it changed in this last and third, I hope the last, but our 3rd surge, we were actually having lots of people in their ages in the age range of 40s dying from the disease, because we had vaccinated those in their 60s and 80s and older. So until we get everybody vaccinated, or at least 70% of the population, the virus is going to continue to kind of fester in the people who aren't vaccinated, and that includes our children, even if they don't get significantly sick from the disease. And that's the other question. People think that children don't have the disease process, but there's 72 children that are in children's right now that they're struggling with the disease, intubated, and have the long-term MISC-C paralyzed issue that we're noticing with they're calling them COVID long haulers. So there's a lot of different components of this disease and how it affects everybody. We are slowly getting up to 50% of the state being vaccinated. until we achieve 70% or more, we're still going to have a lot of disease burden from that. So that's just kind of my opener. I guess I will tell you too, why I vaccinate. I vaccinated as soon as I could. I was vaccinated in December of 2020, as soon as they came out, because I'm at the bedside. And then I had my family and everybody vaccinated as soon as they were up for it. And my 12-year-old, well, he's 11, he's turning 12 June 24th. And on June 25th, I'm going to be taking him to get his vaccination too. I know there's still a lot of fears around vaccination, and I know that they're out there. That doesn't mean I'm saying everybody has to, they've got reasons, but I can hopefully quell some of those reasons, or at least answer the background of concerns as to why you might have questions surrounding the vaccination. So I don't know if you guys want to open up to some questions. I can keep talking on talking points forever, but I'm not sure that's always the most beneficial way to go about having this type of a session. So what are some of your fears? What are some general questions about COVID or vaccinations that you guys may have? Yeah, go ahead. It's on mute, so I'll have to have you unmute.
All right, can you hear me?
Yes, I can.
All right, great. So I got the vaccine, and I was just wondering about if there's a timetable for the vaccine. Should I expect to have to get another one, or is it good for 6 months? I've heard some of those things going around. Like, what can I expect with the vaccine that I have now?
That is an excellent question. So that you may have already had 2 doses, but I'm going to answer that in 2 phases, because after the first vaccination, sometimes people think the second they get the needle put in their arm that they are vaccinated of that as of that moment. But it takes your immune system quite a while to build up those antibodies. So after about a month after the first vaccination, you're at about 65%, 55% to 65% immunity. Then when you get your second one, it re-stimulates your immune system, and that's where you get up closer to the 92 to 95% immunity. Having 95% immunity just means that if you get the disease, you won't die or get intubated. They haven't had anybody who's been vaccinated who's required intubation or has subsequently died from COVID-19. So that's the really big deal. However, you can still transmit it. So if you are around other people that haven't had the vaccination, you can carry it to them, like children, seniors, other loved ones in your community who have not yet had the vaccination. And then when we talk about how long it will last, now we're just getting to the point where we've got 12 and older vaccinated. Once that's been achieved, that'll be a huge part of our population. But we don't know how long they last. So in terms of a coronavirus vaccination, we've only had one other one to compare to. And that vaccination lasted 3 years for the people that received that. And that had to do with some of the disease processes that happened over in China and Japan. So at this point in time, they're suspecting that done just to vaccinate that first group of the first wave of people who've had their first round of vaccinations. There will probably be a booster of 1 shot that may come as soon as this fall. They don't know how long it's going to last because it's a brand new vaccination. So if we guess and benefit from the ways that the other coronavirus vaccinations have functioned, then it could potentially last up to 3 years. They're guessing it's more likely going to be a year to 18 months. So for the time being, we're probably going to have to get this vaccination every year, not the 2-phase vaccination, but a booster each year, just like we get our influenza vaccinations. So there's already a combo flu and COVID vaccination that they're working on. They're even working on them for pediatric dosing, so that in the fall, hopefully by the time kids younger than 12 can get it, they can just get both in the fall and then be done with their vaccination, so they don't have to have 2 separate needles put in their arm, which can be terrifying for a lot of people, but particularly for children. And then to compare the efficacy of the influenza vaccination to the COVID vaccination is upwards of 95%, which is just crazy and really unheard of for a lot of vaccinations. The influenza vaccination, even when you get it, we're still only achieving, and I still encourage you to get it, but it only gives you 40% efficacy from the flu vaccination for the year. So it's a very robust, supportive, protective vaccine for COVID-19. And COVID-19, just to back up a little bit too, if 100 people get COVID-19, 80 of them may have mild to no symptoms whatsoever. And those are the people that get it and aren't fearful of transmitting it. But there's a 20% that we have no idea what their reaction is going to be and how strongly their immune system is going to respond. And we were hoping that after the course of 18 months, we would be able to say people who are really sick or have underlying diabetes or congestive heart failure or other congenital issues would be the ones most likely to die. But unfortunately in the ICU, I've seen 23-year-olds come in that had no medical problems whatsoever that have died from the disease. So we don't know who it's going to hit. We don't know why some people have such a strong response to it where others have no problem whatsoever. We just know that the only way we can protect that 20% that has that type of a response is for everybody to get the vaccination to support them all. So I don't know if that answered your question about how long it will last. It's not entirely known, but that's the best information we have for when we'll have to get another vaccination. It's not going to be a one and done. It's going to be at the minimum once every 3 years and probably every year for a while until we get some more of that data. That was a very good question though. Thank you. Yeah, go ahead. You're still on mute.
You stated that our state is still leading the nation.
Yes.
Although the diocese and myself, we follow the Harvard Brown School of Medicine, and it has shown that Michigan has dropped to number 4 now behind Colorado and
So drop to number 4 in how much? The acceleration or the amount that it's carried in the capacity? Because there are lots of statistics out there as to when you say first in the nation, that could be first in the nation in your vaccinations or how many deaths you're having or how many people are actively infected or how many people have recovered in a population. So what?
Well, this is a 7-day average of positivity rate per 100,000 capita. And the state of Michigan has actually gotten so much better, and many of them, including Oakland County, it shows 11.3%, I believe, as of this morning.
Yep.
What metrics are we using here at Canterbury-on-the-Lakes to determine when staff can be not having to use masks anymore?
Yeah, so that's great. And that is true information, Glenn, when you talk about its infectivity rate throughout the state. We've been playing in the higher levels with Texas and Florida and California and others and New York in the past. And Michigan's been vacillating amongst that. When we talk about the total disease burden, not infectivity rate, but the disease burden, we're still carrying a whole lot in the state of Michigan, partially because when we had our first couple of waves, we were carrying the disease through the southern part of Michigan. Now a lot of it's been going up through the UP, and I think that's why our overall infections have still been quite high nationally comparatively to other states. So we're still very high from that standpoint. If you've got data from this morning that I might not have seen, we may have fallen 1 or 2. Infectivity rate, yes, we are lower because of the masks and the vaccinations, but overall our still positivity rate and deaths per 100,000 are the highest in the nation. So that's the clarification in the data there. Where we get our data is from the same data points you're talking about, the Harvard and national data, and then they work with the CDC and the Michigan Department of Health and Human Services. So there are national repositories that we utilize and cross compare those data sets, and that's where it comes out of. So excellent question, thank you.
Dr. Hurst, what would you say to people who are concerned, who feel like the vaccine is too new and are nervous about the newness of it? What would you say to them?
Yeah, I mean, having a new vaccination or any disease or medicine process that hasn't been tried on lots of people, it's terrifying. I guess from my perspective, having a new vaccination, I compare it to other vaccinations and the things that happen to people as a side effect from vaccinations. And in general, in the past, they used to talk about how people can develop autism and those types of things, but they've found a lot more out about vaccinations, and those weren't related to the vaccination themselves, but related to the preservative that are in them. So that's not an association they make anymore. And outside of that, other than providing the immunity, there have not been major side effects. The Johnson & Johnson had five people with 8 in total at the end of the day that had blood clotting issues. With that being said, that's like 100 times lower than what we women take on as the side effect from being on birth control. So if you are worried about a blood clotting risk, you're taking it on every day with other medications where things still aren't necessarily navigated. It's just so highly publicized. So for me, my perspective of dying from the disease and watching it every day, and the people that we can do nothing to help with, versus giving myself immunity and taking on the risk of what may or may not happen from a vaccine, which we haven't even been able to identify any significant risks and side effects from it. The risk and benefit ratio, which is kind of what we look at anything in medicine when we don't know what the outcome's going to be like, the risk is much, much, much lower, with much, much higher benefits in getting the vaccine versus not taking it.
I have a piggyback. Oh, I'm sorry. Did someone else
A picky question? No, it just broke up for a sec. You have a picky question? Is that what you said?
I do. I have a piggyback.
Piggyback.
Women who are of childbearing age and are
Yes.
nervous about the vaccine and its potential impact on fertility.
Yeah.
Can you see that?
Sure. So that is really crazy. How that even came out, that started in October of last year. We hadn't even been giving the vaccine. It hadn't even been developed until August and September of 2020. And already in October, people were demonstrating fear of its effect on fertility. There is no known effect for any vaccines on fertility. And even if there were some concern that was going to come of it, we wouldn't see that until our population was vaccinated and you waited the 9 months to see if people were having fertility issues. So there's zero data behind that. I don't know where that's come from, but I've talked with many, many women in my world who are pregnant, interested in being pregnant, are actively pregnant, that were fearful from that got the vaccination, are doing fine. And I would rather get the vaccination prior to having a baby, or even while I was pregnant, because then the baby's supported while you were having any concerns that you can even think of during that time period, and the baby's born and immune. So because it gets the mother's immunity if they're still breastfeeding. So from a pregnancy standpoint, or a fear of wanting to have children in the future, I have a 3-year-old. I just had a baby 3 years ago. Zero concern on my front. I would absolutely get the vaccination and do it again if there were fears on that front. I will speak this because that does bring up another issue that I think specifically does affect women of childbearing age, not infertility rates and having your babies, but there are 3, and there's actually a 4th and a 5th vaccination that are coming out. So we had our Moderna and our Pfizer coming out. They have no correlation to blood clotting disorders, but they did find that women between the ages of 20 and 40, there were only 5. Again, this is a very low risk and much lower than even your risk of taking birth control. But with the Johnson & Johnson, there were 5 women who had intracranial blood clotting events. Now, there's only one that caused long-term effects, but the fact that that's out there is of concern. And I'm not supposed to tell anybody to avoid taking any type of vaccination. They say you should get whatever vaccination is out there. But for me personally, I would probably, if I were a woman in the age of the 20 to 40, I would not do the Johnson & Johnson if I had the opportunity. I would go for the Pfizer or the Moderna if it's given to you as an opportunity. And that's just to take it from a 0.0003 risk to a 0 risk. So you're still like 1 in a million chance. It's probably more like 1 in 10 million chance where that would happen. But that's the only thing I could correlate to being of childbearing age and a female. The males, men have had no issue regardless of age, and women outside of that range so far, we have found nothing with the tens of millions of people across the world that have been vaccinated.
Does anybody else have questions right now? I have a few more that people have asked me to ask, but I'll give those on the call a chance to ask if anybody has any right now.
Ginger or Amber, did you have any questions? Or Jennifer?
No.
Dr. Hurst, what would you say to somebody who says you know, things are starting to get better and people aren't getting as sick. So as long as other people aren't getting it, I really don't need to get my vaccine because hopefully it'll die out. What would be your response to that?
Well, yeah, so that's interesting. That is a very common thought process with lots of younger people. COVID is not going to be dying out of our population anytime soon. Even once we achieve 70% vaccination of the population, we're going to have other populations outside of the United States that are going to be bringing the COVID and its multiple variants back into the state. So the issue is not just that the United States may achieve that vaccination rate. And even if you do not travel, we have states around us that have much, much poorer healthcare systems and lack of access. And so those persons, when and if they come into the United States from any world, has the risk of bringing their variants and COVID-19 infection. Kathy, you're off mute, so it's hard to hear.
Picking them up for to go back to
Kathy?
motion.
Sorry.
That's okay. So we have people traveling to the United States from all over the world. Even Canada wasn't allowing us to travel there for a while, and I think that travel ban is still in place. So they are going to be continuing until they get their same vaccination rates up. This is not just a private crisis, it's a public health crisis. So it's going to take everybody out there supporting vaccination to really get on top of this disease process. So holding on your vaccination, while it still keeps you at risk, that risk of getting COVID and having that. Hey Ginger, I think your phone is on too. If you can go on mute.
I recognize one name because at first I was like,
Hold up our phone.
It's okay. Thanks, Ginger.
Okay, what the heck? Okay.
It's all right. It's part of this process. The fun of Zoomness. So even once, when you talk about having a public crisis that takes everybody's efforts to try and help squelch the vaccine, or not squelch the vaccine, although that happens too, squelch the virus, it's going to take as many people as possible. And waiting it out still leaves you at risk for getting COVID-19 and having one of the variants that we don't know how that's going to affect or be covered by the vaccination in the same rate, to be putting you at risk. And then anybody else that's in your world. So they've talked about the fear too, until we're able to get children vaccinated, that it just kind of festers in our population. So even though they're not having symptoms from it, if you have a 2-year-old that catches it, gets a sniffly nose or has no effect, gives it to big brother who's 13, and then big brother carries it back to school, and then there's another couple others that haven't had it, and then they bring it back, and it just spreads and spreads and spreads and keeps doing that day in and day out. And then anybody who hasn't had a vaccination or hasn't had a vaccination that covers that variant is at risk of getting COVID again. So it's pretty crazy how rapidly it spreads, but right now they're particularly concerned about the Indian variant. I already had a 40-year-old unfortunately come to my ICU and die from the Indian variant right before he came 3 days before the travel ban was put in place from India, and had no medical health problems prior to, and also had young children and a wife, and they were fine. Didn't have it, but he did, and he died from that. So it's understanding from a population level how the virus spreads and how we can best do everything we can to support stopping the virus. And that's what I would encourage anybody who has the ability to help your neighbors, your family, and everybody in your community to get the vaccination.
And are you seeing, Dr. Hurst, people that have had the vaccine testing positive for COVID after they get the vaccine? And if so, what has been your experience in those cases as to does the person get sick or have they not been sick?
Yeah, so it's important to clarify the difference between you get your first vaccination, and so you've already stimulated your immune system. When you get your second vaccination, a lot of people are getting sicker, and some people were so fearful of getting their second one because they get sick. They don't die and they don't get this COVID-19 virus, but their body is giving their very robust immune response to the vaccination. And so sometimes when you get the second vaccination, because your body has already been stimulated by it once, you have a very strong reaction to it. That is not getting COVID-19 and or dying from it. That's what your body's supposed to do. And I know people are fearful of that, and I can talk to that if people have additional questions. Once you've had the vaccination, it still takes another month after you've had the second shot to get up to the 95% immunity. If you happen to get the Johnson & Johnson, which is just a one shot, that one, the highest immunity it's getting to is about 67%. So it's not the same, but any vaccination that you get, once you've completed the course of whatever's recommended for the way that vaccination is constructed, we have not had anybody die or be put on a ventilator, which is where people are dying when it comes to COVID-19. People aren't dying from having a horrible, cold symptom and being tired and fatigued for a day. Although there are people who are having what are called long-term, long hauler COVID effects, where some people have such profound exhaustion, they can't do things like they used to. And the other part that's particularly concerning for those that are younger, they may not get to the point of intubation, but we have people that have gotten, that have required being on oxygen, and then COVID after about 3 weeks causes fibrosis in the lungs. And so I have some very young people who are on oxygen for a prolonged period of time, and some that are going to be on it for the rest of their lives, which is a pretty stressful thing to be getting in your 20s and 30s. So you may survive it, but you don't, you still have symptoms. But those are people who have not been vaccinated. If you've been vaccinated, that's not happening to that population. And yes, you absolutely, even with vaccination, can still get COVID-19, to be clear. When you get 92 or 95 or 67% immunity, that just means you've got immunity from that percentage. There's still the 7%, the 5%, or the, I can do my math today, 33% chance that you're going to pick up a virus. And if that lends to another thing too. Getting COVID-19 does not mean you're immune to getting COVID-19 again. It just means that the one variant that you got, you have created immunity to. The vaccination actually gives you immunity to a greater, broader range of COVID variants because it attacks the proteins inside of COVID itself, not the specific virus you get. So far as we know, we are doing very well against the variants out there. The one they are studying now, as I mentioned a little bit before, is the Indian strain right now that is particularly transmissible. And because it's a virus, viruses versus bacteria have the ability to morph very, very quickly into other strains of the virus. And so that puts us at risk for still getting it. And so if we have immunity to 95% of the viruses out there and we get the 5%, we may not have any symptoms from it. And that's the best part. And that's why we want people to get vaccinated. But you could still carry it and transmit it to somebody else who is not vaccinated, whether that's your children, whether that's somebody else who's older or a grandparent or somebody else for whatever reasons have chosen not to get vaccinated. So that's where the risk is. Even though we're getting vaccinated, we're still going to be carrying it in our population for a period of time. And that's why they're encouraging everybody to get vaccinated, not just those who have the risk of dying, because we don't even know what that perceived risk is. It's everybody's at risk for having long-term negative side effects and consequences from COVID-19. You guys can ask anything. Yeah, go ahead. I was going to say ask anything because I I'll tell you as honestly and truthfully as I know what information, and if I don't know the answer, I will be happy to get it and bring it back to you or send it to Christy so she can share it with the group. I see a hand again. Yeah, go ahead. It's still on mute. Thanks, Mark.
All right. Is there any thoughts as to when the masks, we might be getting some relief with the mask around here at Canterbury?
So I don't know specifically about Canterbury. It's statewide. They are going to start lifting the mask recommendation indoors and outdoors as of July 1st. So that's a little interesting because the state plan that was created, and it's not just through the governor, it's through all the healthcare providers and legislatures across the street that also worked with the Michigan Department of Health and Human Services, had said that we had to achieve higher levels of immunity than I think we're going to be to by that time period. So masks are going to come off in general outside and when you're indoors or outdoors outside of healthcare facilities. However, at this point in time, I believe healthcare facilities are still going to continue wearing masks because of two issues. One is they won't know if those variants are going to be covered and if we're going to have another surge. So they're going to really want to protect our healthcare facilities and the people within them. to make sure that until it's very clear, until we've got greater vaccination ability, that they are not probably going to let up their risk of taking on masks. So we are going to probably have masks specifically at Canterbury for quite a while yet. And I don't know the answer to that because they haven't figured that out just yet. Healthcare facilities specifically are going to continue to have mask wearing to protect their populations for a while yet. And I wouldn't even be surprised if it's still another 6 months. But that we're taking our direction from information from CDC and the Michigan Department of Human Health and Services. And there are some state regulations that are put upon us too about what we have to do and how long somebody has to be tested and be put on quarantine and mask wearing. So I don't know where that lands just yet, but I would suspect we're going to still be wearing masks for a while yet. I know that's not what everybody wants to hear. Everybody shakes their head, but I know they suck. I got sores in the backs of my ears. I get acne all day long. I've had more zits on my face than I remember when I was like a 12-year-old kid. So wearing these masks, even though I change it up regularly, they're not fun to breathe in. But they're still protecting a very vulnerable population. And so my suspicion is we will have them for a while yet. Glenn just gave a big sigh. I know. I'm sorry. I will tell you as soon as we can get them off. I promise.
Have you seen Dr. Hurst who's had the vaccine? Like I had mine in January.
Mm-hmm.
Have you situations where I might test positive for the virus now?
Mm-hmm. Yeah.
You have both doses?
Yeah, it broke up a little bit, but you said, can somebody test positive after having the vaccine? Yes, absolutely. Absolutely. The vaccine does not preclude you from getting COVID. It helps your body already have a robust immune response to getting the virus. So maybe I'll come at it a different angle. Because so for instance, I've had both vaccinations, and I take care of a patient who has COVID-19. I pick it up, even though I wear a mask or I didn't wear a mask well enough, whatever the reason is, I get the virus from that person. For me personally, although I may have it, I may test positive because I have the virus. I won't have the response and the reaction to it, but I can still carry it home to family members, to other people in the healthcare community, to other people in the intensive care unit or at Canterbury. So I have to still be careful. However, by wearing a mask, even if I'm positive and I'm immunized and I don't feel sick, I'm protecting others from me spreading it to them, even though I may or may not knowingly have it. So if they tested everybody in the population and you found out I was positive, then the only way I would not be spreading it to everybody is to have that mask on. If I felt fine and well, I probably would have no reason to get tested unless somebody determined I needed to be tested. And so nobody would know that I was even carrying it. Does that answer your question a little bit better, Christy, as to what you were trying to get to?
Yes, thank you.
Yep.
All right, does anybody have any other questions?
I have one more topic I can talk on that I know people have been at least generally fearful of when I've talked about it. There's the mRNA vaccinations and how they are created. And there was a lot of fear based on this, and maybe, you know, Glenn, you can give me some more insight and thoughts into the vaccination. But when you talk about the Pfizer and Moderna, they are both made with mRNAs, and that is mRNA. So just like DNA, it's reverse nucleic acid, which has to do with DNA, and it's something that rapidly produces in our body. The only way that you can attain and get some of that mRNA strand is through early tissue. They talk about it being fetal tissue. And so that scared a lot of people, thinking that we were making vaccinations from dead fetuses. And to be clear, there are lots of tissues that happen when a female is pregnant. They're called pluripotent cells, and they are cells that a woman's body produces that are also in the umbilical cord, in her bloodstream, in the placenta, not directly from a fetus tissue, that carry these pluripotent cells. And those cells are the only cells that exist anywhere in space for doing something like creating this type of mRNA vaccination. And so the vaccinations that have had that are not created from fetuses. That's something that was a big fear that was out there. It comes from early tissue and pluripotent cells that a mother may be carrying. And so that was a big difference for people that were fearful of. And if your religious background and guidelines are still such that you're not comfortable with that, that's absolutely within your purview. But that's something that people were really fearful of early on in the vaccinations. And then we had subsequent vaccinations that don't have that background because they're not made from mRNA, but then they have other risks and side effects from them. So I personally didn't feel like I was having any effect on babies or causing abortion or anything along those lines. It's not from that framework that a lot of people were really scared of. I hope I didn't just open a can of worms that people didn't even know about that they're afraid of, but I'm pretty sure it's been pretty out there. So I can answer questions on that if anybody has significant fears, because I know that was a big topic early on when vaccinations were coming out too. And Glenn, feel free to add anything further on that if you have other thoughts.
Dr. Hurst, I have a question.
Yes.
So in our business of killing this virus, we've been led to believe that it's fairly easy to kill. So we don't need real strong disinfectants and things like that. Is there any correlation to the vaccine and how easy it sort of protects us? And what I mean by that is when you're looking at the full spectrum of vaccines, are there vaccines that are tougher on the body or more aggressive? And are there other vaccines that are a little easier on the body and less aggressive? And then if there are, where does this vaccine fit on that spectrum?
Yeah, so that's a really great question. There were a lot of pieces to that. One, the first part of your question that I heard you ask was, is the virus easy to kill? Yes, they're talking about simple disinfectants. You don't have to use those horrible, caustic, terrible astringents to kill the virus on surfaces. And even just simple washing of your hands is enough to get rid of the virus. The problem is it's still so highly transmissible. Even if it's easy to kill, it's also easy to spread. And so it's on any surface and it has the ability to last there and linger in the air so that we breathe it. And we do have some capacities to clean the air, but not around everybody and all the disease that we've been seeing as it's been spreading. The vaccination on the body, aside from the clotting issues and everything else that happens, mRNA vaccinations are the easiest to make because they come from that pluripotent cell I was talking about, but it also creates one of the most robust immune responses that we have. And so people do, when they get that second vaccination, some people were laid up for 2 and 3 days feeling so sick. The good part is once it's gone, once they recover from that, they're fine. They don't have long COVID hauler symptoms. They don't have COVID-19. They don't die. They don't go on a ventilator. So even though getting the second vaccination can be rough on your body, it's because it stimulates such a robust immune response. And that has to do with the way it was created and how fast. We have never created a vaccination within a 9-month turnaround time period of a disease and be able to widely spread it to our population. That's been one of the modern advancements of our medical technology that we have, fortunately, to help with this pandemic. Because our death rates have already been in the millions, it would have been way, 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 way higher than that if we hadn't developed this vaccination to help slow the spread. And it has not stopped the spread. But if you want one that's a little less aggressive on your body, you can go to some of the ones that took longer to develop, which is why they took longer to develop, because they weren't mRNA. And so the Johnson & Johnson and other ones are not, they're still great. They still provide immunity and people are not being intubated with them. They do not achieve as high immunity as the mRNA vaccinations do, but they are also a little easier on your body. So if you're concerned from that standpoint, I would consider getting one of those. And there are several others that are going to come out this summer yet that have not been launched, that were made in a slower fashion without mRNA. And I don't know the background and side effects of those yet because they haven't been fully released, but as soon as those are, or our FDA approves ones that other countries have been using that have been created in a different way, then I will be happy to update this group further on that. But that's a really good question. I know some people have been dissuaded from taking the vaccination because they are sick and they were afraid of their response to the vaccination. I unfortunately had a gentleman just a couple weeks ago that he has severe COPD. His pulmonologist told him not to get the Pfizer vaccination because it would be too much of a response to his immune system. His wife got COVID, he got COVID. he came into the hospital and unfortunately he died. And although having a really robust immune response can be difficult, it's better than the alternative, which is not surviving it. And so from the unfortunately hundreds of cases I've seen, I would still, even if you have a robust immune response, and you can compare it to probably the best response you had to like the MMR, measles, mumps, and rubella. If you remember how strong your response was to that, that's probably the closest comparison to what type of response you might have to this vaccination. Or if you know you have a really robust, strong response to like your influenza every year and you always get sick for 3 or 4 days, you're probably more likely to have a stronger immune system to this one. But those also are the people that we're finding are having the huge immune responses to COVID and are more likely to die. So I wouldn't use that as a reason not to go ahead and get the vaccination, as scary as that is.
And Ginger, I have a question for you, if you're still there, because I think that we are offering after the June, I think it's June 4th, June 3rd, when we have our second, I think we're having one last clinic for the people who got their first dose on May 4th, and that is the Moderna vaccine.
Yeah.
And then after that, we're going to have the Johnson & Johnson option to offer here.
We haven't made, I think we're going to try to be offering both. I'm not sure yet, because the problem that we're having right now is Johnson & Johnson has 5 doses. And we have to send in for it, like let them know how many people are going to get it. And they'll send it out once I have 5. Moderna, they want 12 people signed up before they will even send me the Moderna that is up to 14 people. So you see how that goes? Yeah.
Yeah, that's because Moderna and Pfizer are much more unstable. They require refrigeration and they don't last as long because they were so highly, they're very robust and quickly made vaccinations, so they're not as stable. The Johnson & Johnson is so stable it doesn't even have to be refrigerated, which is why you've got a lower number and you can get those more readily.
Okay. So yeah, it's like I sign up for it, I tell them how many, give them the names, and then they send it within 2 days, but that's where we are right now with that.
And I just want to remind everybody that, you know, there's a lot of opportunities in our local area now to sign up to get the vaccine if you choose not to get it here at work, and that we will gladly support you in any way in going to get it. So if you need time off of work because you got an appointment and you want to go get it, we will gladly accommodate you leaving to go and get your vaccine. Uber and Lyft are offering free rides for people to get to their vaccine. And then once you do, you get an extra day off from us, an extra holiday to use for the year 2021. So that offer of all of that still is out there. Anything that we can do to help support you getting your vaccine in a place and time that's comfortable for you, those options are available to you.
And if you have a question that you either thought of after the fact or that you were not comfortable asking in a group setting, I make myself very available to our staff for any questions you might have. I'm happy to have one-on-one discussion or anything if you have questions that I can help support answering.
Okay, last call. Any other questions before we wrap up our call today? Okay, it looks pretty quiet. Thank you so much, Dr. Hurst. We so appreciate your time and you doing this for us today. We're very grateful.
I hope it helps. So thank you guys all for your help and commitment to this process too.
And thanks everybody for coming, and hope you all have a good rest of your day.
Bye.